This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
We are really very grateful for each of you joining us today. We have survey information that we would like to share, and the survey is a product of a partnership of the Wisconsin Personal Services Association, Wisconsin Long-Term Care Workforce Alliance, InControl Wisconsin, and Survival Coalition in an effort to learn more about the experiences of direct care workers directly from direct care workers. The survey was shared throughout Wisconsin via advocacy networks and social media. Today, I'm really, again, very excited that we will have 5 speakers joining us today, sharing their stories, direct care workers and consumers. Direct care workers have been true heroes during COVID-19 pandemic. They continue to go into people's homes day after day to support them with bathing, dressing, meals, all while putting their own health and their families' health at risk. They deserve better pay and benefits. It's discouraging, but not unexpected, to learn that more than half of direct care workers work a second job to support themselves or their family. As well, all ages and people, as we all age and people live longer, most of us will someday rely on direct care workers. This is a profession we need to elevate. I'd like to share just highlights of the survey, which represents the experience of direct care workers from throughout the state. In Wisconsin alone, we have more than 100,000 direct care workers. They are a central part of the economy and the workforce. Our survey represents findings that despite the inherent difficulty of the work, access to a job with higher wage or a position with health insurance or more affordable insurance were the top reasons direct care workers gave for considering leaving their current position. Nearly 3/4 of respondents said they would stay in their current direct care position if there were consistent bonuses or pay increases. About 1/4 of respondents either don't have health insurance or make so little they qualify for state-funded Medicaid Badger Care. More than 1/3 who were offered health care through their employer said it's unaffordable. 2/3 of direct care workers spend more than $200 a month on healthcare costs, such as copays, premiums, out-of-pocket costs, while 16% that they pay more than $300 a month. Nearly 200 respondents indicated that they had to make the choice to pay their health insurance instead of another living expense, with 45% saying they have had to forego paying electricity or utilities, and 38% reported they went without purchasing food. More than 1 in 10 have turned down working additional direct care hours to suppress their wages to continue to be financially eligible for public benefit programs like healthcare, food stamps, or childcare. Nearly 2/3 of responding direct care workers said they were likely or very likely to continue to work within the direct care field if there was a career pathway to attain a certified nursing assistance, CNA, or other nursing degrees. Currently, there's no pathway which exists. Direct care workers indicate that they stay with the profession mostly because of concern and care for the people they support. 70% of the respondents This was their statement. And the other 51% stated that it was truly the rewarding nature of the work that keeps them. I would like to really highlight that the results show that this essential workforce continues to struggle with low wages, lack of benefits, and daily struggles with balancing their strong commitment to the people they care for and the financial struggles it can put them in personally. I would like to introduce our first speaker. Tom is a direct care worker, Tom Cooney. Tom is from Madison and supports Ben to live in his own home and navigate the challenges of staying connected during COVID. Tom and Ben have a deep and strong friendship and great respect for one another. Welcome, Tom.
Thank you. Or should I just tell my story or?
Yes.
Okay, well, I've been working with Ben for, I believe I'm going on 10 years now. If it's not 10, it's 9. And for the first 5 years, Benny was living with his mom and dad. And in 2000s, at the time, I was working with Ben and another client. In 2016, an apartment became available for Ben and a roommate. And I had to decide whether or not to go with Benny. If I were to do that, if I were I found out kind of belatedly that if I stayed with Ben, my agency would not be able to support me. In other words, they couldn't support Ben because he was in his own apartment. Upshot was I had to decide whether to stay with the agency or stay with Ben. And I chose to stay with Ben. And even though I was still working at the agency with another client, my hours dropped to the point where the insurance was unavailable from that point on. And so, well, I chose Ben, and I was just lucky that Benny's mom, I would have done it anyways, but I was very lucky. Benny's mom is very plugged into all this stuff and was able to help get me a raise to offset the cost of the fact that I had to get private insurance, had to go on the insurance market on the ACA and get it. So I did that. It worked out well for me, but I realize not everybody has got access to somebody as plugged in as Ben's mom is to all this to help navigate, help advocate for me and for everybody else, higher wages and so on and so forth. Had Barb not been around, Ben's mom not been around, I don't know that I would have made that choice. And Benny, in all likelihood, would not have been able to move into his new apartment. He can't, there's no way. I mean, it sounds like I'm tooting my own horn, but I believe pretty strongly that Benny wouldn't be able to stay in his apartment without me. There's only a couple of workers that go, okay, now there's only me. With regard to the wages, well, what can I say? They're low. Although I was able to get an increase to help offset my insurance costs. My background
It appears like we're having some connection difficulties with Tom. So I'm wondering if perhaps we could circle back to Tom and move on to our next speaker. All right. I'd like to introduce, hopefully Tom will be able to reconnect with us. Our next speaker is a consumer, Stacy Elligan. Stacy is a small business owner in Oshkosh, a member of the Wisconsin Department of Health Services Long-Term Care Advisory Council, and longtime advocate in Wisconsin and beyond. Welcome, Stacy.
I'm Stacy Elligan. I'm 35 years old and live in Oshkosh. Due to complications at birth, I have cerebral palsy. It affects all of the muscles in my body. I need assistance with all of my basic needs, such as toileting, dressing, and eating. Thanks to the help of caregivers, I live in my own apartment. I hire caregivers to come in and help me with my daily needs. I've been hiring and scheduling all of my own caregivers for over 4 years now. Basically, I have no other choice but to. If I didn't, I'd be in a nursing facility. I'm very fortunate I have a very supportive family who have saved the day many times when workers don't show where I can't fill a shift. If I didn't have family support, I wouldn't be able to live on my own. I've had many horror stories about going without care. I've slept in my chair on multiple occasions when I couldn't find workers to help me get in bed. I've skipped many meals and gone without using the restroom due to not being able to find workers. The worker turnover rate is unbelievably high in this field. I live by a college campus, so most of my caregivers are students. They come and go so frequently. I've tried hiring non-students, but due to the low wages and no access to benefits, it's nearly impossible to keep them for any length of time. It's incredibly sad that people can make more money flipping burgers at McDonald's or stocking shelves at Walmart than they are able to make taking care of people. In a recent survey of direct care professionals, 76% of the respondents say that the main reason they have considered leaving the profession is for a higher paying job or one that provides benefits. People need to be able to make a living wage in the field. It's only right. People with circumstances like myself rely on caregivers literally to survive. It's time for things to change.
Thank you, Stacy. I just want to remind folks that we will have time at the end, hopefully, for any questions. I'm looking at my screen and it appears that Tom has rejoined us. So, Tom, we had a little connection issue. So, like to return to your presentation. Thanks.
Yeah, I don't know if it's I think it's my internet connection here is spotty sometimes, but at any rate, I forgot where I was. But I believe I was saying that when it's fulfilling. It's for me, it's a routine. I mean, it's something to do every day, but I really enjoy it. You know, he's a hoot. Even when I'm not working, I take him with me sometimes to concerts, so on and so forth. But again, the pay, you know, it just doesn't cut it. Even with the raise I got, I'm lucky that, well, yeah, I'm not sure where I'm going with this, but the pay really needs to go up to attract workers. The agency I was with, I noticed the turnaround was absolutely horrendous. And I asked people why, why when they would interview and they found what the pay was, they'd go do something else. It's occurred to me. I think I mentioned it's occurred to me that I could do IT consulting and make a whole lot more money. And I may do that in part-time or something, but even though I like doing this, it's just for me, it's worth it. I mean, I'm lucky enough I'm in a position where the pay isn't killing me, but other people aren't. And I believe that's one of the main reasons why. And now during this COVID thing, people got to go into, they got to get out of their safe zone. They got to go somewhere where, in Benny's case, luckily, excuse me, he doesn't go very many places nowadays, but he does go occasionally. And so I got to go over there not knowing who he's been exposed to. So, it makes me a little nervous, but I don't know. I feel pretty safe with Benny. He doesn't go that many places, but Todd was saying earlier, that most people, they gripe about the pay. Well, my thing, it's not just the pay, it's the fact that benefits are not offered. I mean, if they are, you have to work X number of hours, which are always being cut. It's the bar is being raised further and further and further. And then if you're with an agency, they're cutting your hours to avoid paying that. Well, who the hell in this day, and you can't go without health insurance. Who in this day and age would willingly do this, regardless of how much they like the job? I don't have a whole lot more to say, but I enjoy working with Benny. I'm going to keep doing it for as long as I can. But as far as people looking to this job as a career, until things change, I don't blame them for looking elsewhere, to be honest.
Thank you, Tom.
You're welcome.
We will now move on to our next speaker, who is also a direct care worker, Anna Phelps. Anna from Appleton provides care to Kelsey. She always supports Kelsey as an independent individual. Anna's energy, respect, dedication, and persistence are examples of qualities that contribute to quality care in extraordinary circumstances. Welcome, Anna.
Thank you. Hi, everybody. Yeah, I've been taking care of Kelsey. It's been a little over 9 years since I met her. Her and I, we just had a natural connection right away. She's just a really goofy girl, likes to have a lot of fun. So yeah, I ended up becoming a personal care provider for Kelsey probably around 6 months after I met her, providing respite for her family. And I've been with her through a lot of different transitions. Like her daycare did shut down for 6 months, so I had Kelsey full-time then with my infant at the time. Kelsey has transformed greatly in her flexibility with care providers, her ability to transition, and just been just a great friend to me. She's just an awesome friend, always accepting, cheers me up even when I'm not feeling great myself. And, even when we go around in the community, Kelsey is always getting people's attention, smiling, waving, blowing kisses, and getting these, smiles and laughs out of people everywhere we go. So being with her is, just being friends with her, being her provider is awesome. On top of that, her family is just a bunch of amazing people. I have been lucky also to be very well supported by her mom. She's become a good friend of mine. And so for the whole time that I've care provided for Kelsey, I've always worked one or two other jobs. Most of the time waiting tables for my primary income. income. And so with waiting tables, I make 2 to 3 times more per hour than I make care providing for Kelsey. So, I mean, it works out for me when things are normal, like, before the shutdown happened, I was getting along fine. I am a single mom of 4 children. So when the shutdown happened, I had 4 children at home half the time and had to be able to work all the other time. I have to make all my money to pay all my bills in, the time that I don't have my kids home doing school. So it's been a major challenge. There's a lot of pressure. There's a lot of extra anxiety about, if I were to transmit an illness at work, working with the general public, and then be in contact with Kelsey, who has more vulnerable health. And then also the fact that she receives care in a day center where there are even more vulnerable people. So that's been a lot of extra stress with the shutdown. Not as much money, obviously. The restaurant shut down for months. And then I was care providing, for Kelsey and working for an agency, working full time, making half as much money as I was when I was working all 3 of my jobs before the shutdown. Unemployment doesn't actually kick in unless you work less than 32 hours a week. So I worked full time during that shutdown care providing and didn't drop below 32 hours, but maybe 2 times. So it's been a struggle that way. And then, so right now, we had a time where I was back at work at the restaurant, and then we made that collective decision, me and Kelsey's parents, that I wouldn't care provide for her. They were home from work. They were able to provide care for her. And here I was, in contact with, thousands of people a month, basically, who are, just going out and about, going out to eat. So I guess the pressure now is, that if the care providing, wages are raised, then it makes it a lot easier, for people to continue to provide care when things happen, like her daycare shutting down. When the restaurant reopened, the daycare didn't. So things weren't really lining up that way. And so it's like, if people could get paid a living wage, then, it wouldn't really matter if we need to shut down, or people aren't going out to eat and consuming as much. We can all still, get the care providing that we need, be able to pay our bills, and et cetera. Did I cover everything that I was supposed to cover?
Thanks for sharing your story, Anna. We really appreciate it. Our next speaker is also a consumer, Amy Bliley. Amy, a special education teacher from Whitewater, is here to share with us the realities of maintaining a team of care workers before and during a pandemic. Welcome, Amy.
Thank you. Yes, I have a spastic quadriplegic CP, like Stacy, and I live in Whitewater, which is a college town. And like Stacy said, a lot of my caregivers are college students, and it is hard to find them and keep them. The turnover rate is high because the pay is low, and trying to hire people from the community is tough because they don't have insurance, and that's not a career job they can have with such pay being so low. And they help me with all activities of daily living and taking me to doctor's appointments and helping me just with every activity of daily living. And with COVID being so horrible right now, it's made it even more difficult. Right now, I only have 2 caregivers that are able to work for me because everybody else is either COVID positive or exposed and needs to quarantine. And I have 10 hours a day And because I have pre-existing conditions, I cannot be exposed to COVID, and I'm waiting to have surgery right now. And so it makes it really hard for them to cover all of the hours that I need to have covered. So it is making it a situation that is normally difficult on a regular basis, extremely difficult to have that taken care of. So it makes an already difficult situation even more difficult. But luckily the girls, they come because we have a good relationship and we care about each other. So I'm glad that they do come, and they're trying to, be safe and do all of those things and making sure that, I don't get sick. And so that's why, they can't come. So.
Thank you for sharing that. I see that you are with one of your direct care workers, Kate Simon. So thank you for joining us as well. So Kate is a college student in Whitewater, and as Amy suggested, is a critical part of her daily support. Katie is going to share about the challenges of balancing safety, schoolwork, and ensuring Amy's cares during pandemic. Welcome, Katie. Thank you.
Thank you. So I would have to say this job, growing up, like being in a college town, there's a lot of other jobs that I could easily do that pay better, like work better with my school schedule, all of this. But I really think this job, because Amy, we have such a connection that it just fit. And she really tries to help with us girls. Like, she tries to make things fit with us as well as like her. So her schedule, she'll make us flexible if need be. That's why I would choose this job over any other job. It's probably my favorite job I've had so far in my life. It is definitely difficult though, with school, having all those hours. I'm a full-time student. And then especially with COVID this week, a lot of our girls are sick or have been exposed. So it's just 2 of us this week, and taking up all those extra hours cuts into my school. But I make time for both, and I wouldn't change it.
Great. Thank you so much for what you do each day.
Yeah, my life couldn't function without these girls. I wouldn't get to, I wouldn't get to eat. I wouldn't get to doctor's appointments. I have had to sleep in my chair. I wouldn't get to, work my job as a special education teacher. Although we're working from home right now, but my life would not function without these girls. They are critical to my everyday life.
Well, I think that's, one of the things that we hear consistently is just the importance of the role that direct care workers play. It's an important relationship. And I say relationship because, when we look at the results, it's what people identify. It's the care and commitment and the bond that is formed with each other. So we're very grateful to be able to share many of these stories today. And this is just, these are one of thousands that exist, and the struggles that our consumers face in just accessing, a meaningful day, whether that's going to work or out in the community or a doctor's appointment. And so the independence that this provides is essential. Direct support professionals overwhelmingly state that while the work is rewarding, unfortunately, low pay and lack of advancement opportunities make it difficult to stay in the profession. It appears that we really need to move towards systematic changes that are needed to professionalize the direct support workforce in order to attract and retain high quality workers. We do have proposals developed by the Governor's Task Force on Caregiving, which offers a roadmap to move forward. I believe direct support professionals are asking policymakers to act on these proposals. Just highlights from these proposals would reform the way providers are paid within Wisconsin's long-term care system to reimburse them for actual costs of direct care with a rate that reflects the dignity and importance of the work and allows them to not only compete with other employers for qualified candidates in their communities, but to pay workers a living wage. The need for statewide direct support professional training, which would create a career ladder leading to CNA certification. Public assistance earning disregard, which will allow direct support professionals to take on additional hours without losing access to much needed public benefits. Continuation of Family Care Direct Care Work Fund, which provides bonuses and other incentives to recognize the great work that our direct support professionals provide each day. You know, when people doing the essential work of caring for others can't afford to pay for food or utilities, it's time to do something. We urge legislators and the public to take a good look at the Governor's Task Force on Caregiving recommendations and begin implementation now. There is a link in the chat feature to the task force policies. Now I would like to open up the discussion for any questions. And again, I wish to thank the media for joining us to take part in this important storytelling, to hear the challenges of the pandemic. The current direct care workforce has only been exaggerated by it, but more importantly, to hear directly from workers and consumers who rely on these necessary services. So with that, I'd like to entertain any questions for our speakers or other questions you may have. And again, welcome and thank you for participating.
Todd, I'm not sure that there are questions. I don't see anything in the chat, but I did want to point out that in the chat is the link to the resources that we sent out in the media advisory kit, as well as the Governor's Task Force on Caregiving recommendations that you mentioned earlier. So those are in the chat. Don't know if there's any further questions from anyone.
All right. Well, again, thank you to our speakers for taking time out of your busy days. And we know that we were probably keeping you from doing really important things. So we thank you for your stories. We thank you for your service.
All right.
Thank you.
Thank you.
Have a good one. Thank you.
Thank you. Thank you. Stay safe.
Take care, everybody.
Bye now.
Have a great day.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.